First thing we're going to talk about is acne. Acne is a skin disorder of the pilosebaceous unit. So this is going to cause an inflammatory response from the skin. Now, acne can affect somebody's physical, psychological, and social health. You may see some clients that struggle with body image because of this. Adolescence, which is usually when this begins to develop, they can develop anxiety, depression, and if we don't treat it and it's severe enough, it can cause scars, which can give them long-term body image disturbances. Acne also can cause physical pain when they get those cystic lesions. The medications we use, first off, is retinoids, topical. One we have alloretinoin, which is a form of vitamin D. Now what happens for the topical retinoids, they're going to bind to those retinoic acid receptors. It's going to stimulate those cells to turn over, and that's going to stop sebaceous gland function. It's going to decrease that sebum production, and so therefore it's going to decrease some of the manifestations of acne. These prevent clogging of pores, and it's going to diminish fine lines. So if you need it for aging as well, you can use it. Topical retinoids are used to treat acne vulgaris, inflammatory acne, again, fine lines and wrinkles, and we also use it for hyperpigmentation. Anyone that's sensitive to it, anyone that's pregnant should not be using it. They can, as far as side effects go, develop some dry skin. They can get sensitivity to sunlight. Their skin might peel, burn, sting. Some of the adverse reactions we may see, they might develop a hypersensitivity rash. If we're worried about that, we can do like a little patch test, just do a small portion of their skin. Now, the next one that we have is an oral retinoid, isotretinoin. This is a form of vitamin A, and the trade name that we see with this is Accutane, if you've heard of Accutane. And what it does is it's going to shrink those sebaceous glands. That's going to prevent excessive oil production. And we use Accutane when we have someone with severe acne. Contraindications, again, if we have someone who has psychiatric disorders, diabetes, we really don't want them using it. Someone who's pregnant or can become pregnant. This is one of those medications that we want them on birth control, preferably 2 different forms of birth control because of its teratogenic effects on the fetus. You'll see that some physicians, before they will prescribe a new month or a new prescription of Accutane, will have their client to take a pregnancy test. They also have to register with the iPledge system, which we're going to look at here in just a second. Some of the side effects from the oral retinoids are going to be things like dry lips, dry skin, dry mouth, and of course it can cause sun sensitivity as well. Adverse effects, again, if it causes a lot of itching, a lot of skin irritation, it can cause their skin to kind of thin out a little bit. Dry eyes, their hair can thin out. There are some incidences of increased suicidal ideation and depression with this medication. So we want to teach them about why they're taking this medication. We want to make sure that they understand that you cannot get pregnant while you are on this medication. We absolutely do not want you to get pregnant because of the risk of birth defects. Benzoyl peroxide, if you've ever heard of Oxy, this back in the day, this was a big commercial they used to have, benzoyl peroxide. This releases oxygen. When we get that oxygen, it's going to kill the acne-causing bacteria. It's also going to break down those dead skin cells and oil. It also helps to unclog some of the pores and reduce the inflammation. So therefore, what it's going to do, again, it's topical. It's going to reduce the bacterial properties, so it's going to lower the inflammation, which should lower some of the redness. It's going to dry out the skin, get rid of some of the dead skin, and helps to stop some of the sebum production. We don't want to use this over an open area. The skin does need to be intact. Benzoyl peroxide is really for mild to moderate acne. We want to make sure that they're not getting a lot of exposure to the sun or to artificial UV light as well. Now, it can cause bleaching of the fabrics. Again, it's got that peroxide in it. We know that peroxide can bleach fabric, can bleach hair. We also know that because this is a chemical, it can cause some burning, some skin itching, peeling of the skin. If someone is hypersensitive to it, that could cause anaphylaxis or angioedema, so that would be adverse effects for it. We also want to let them know, here's kind of a side note about benzoyl peroxide, is if they are already allergic to cinnamon, they could also have an allergic reaction to benzoyl peroxide. This is the iPledge form, the iPledge program, and it basically just says if we have someone on isoretinoid and they understand that they cannot get pregnant, they have to use birth control, and they do have to sign this at the provider's office. Salicylic acids. Salicylic acid topical is the example that we're going to use here, that has a keratolytic effect. So that means it breaks down that skin tissue. That's going to decrease the number of papules, pustules that the person has. It is a topical medication. Again, we only want to put it on the intact skin. What it does is it's going to cause that skin to dry out and shed. We don't want to put it over their mucous membranes because they can have a sensitivity to it. Now, we use this for acne, but we can also use it for seborrheic dermatitis, dandruff, rosacea, psoriasis. If you have ever had a corn or a wart or a callus that you're trying to get rid of, the things that's on those wart pads are salicylic acid. If we have someone who's hypersensitive to it, we don't want them to use it. We also want to make sure that they have good blood flow. It can cause some irritation and stinging. Adverse effects would be like ringing in the ears, or it might have photosensitivity, but really not a lot of those do we see. We want to let them know if they have a rash that occurs to go ahead and stop taking this medication. So if you ever see Nate the Hoof Guy on any of the reels on Instagram or TikTok or anything like that, he always puts, if his horses have dermatitis on their hoofs, he pours on a lot of salicylic acid and wraps it up, and it has some anti-inflammatory properties and helps to heal. So that might help you to remember that as well. The next category we're going to look at are topical macrolide antibiotics. So we're talking about a topical medication, so something like erythromycin that is in a topical form, so it's in a cream. We can use it to treat acne vulgaris. Again, it can cause some dryness, some burning, some redness around the area. Tetracyclines can also be used if we have someone with a really severe acne outbreak. Doxycycline is what they might be prescribed. This is a oral antibiotic that they're going to take, and it's going to stop that protein synthesis of that bacteria. Now, they can have some GI effects and photosensitivity as a result of taking this medication. We do not want to use this in pregnancy, because here's something very important to remember about doxycycline or any tetracyclines, is it can affect the formation of the baby's teeth and cause teeth discoloration. Next is dermatitis. Dermatitis occurs when we have a disruption of the skin barrier and it activates our immune system. This can be maybe because of an external or environmental factor. We have something called irritant contact dermatitis, what we would consider a rash. We say someone develops a rash. That's what they have, is irritant contact dermatitis. This is caused by disruption of the skin barrier. It's going to cause a cumulative toxic irritant effect. So that, therefore, is going to release cytokines to cause cellular damages to the skin. Then we have allergic contact dermatitis. This is what happens when we're exposed to some type of allergen, so things like poison ivy, poison oak. We also have eczema, or what we call atopic dermatitis, and this happens when we have a disruption of the epidermal layer. It is caused by maybe a dysregulation of the immune system, and it's going to cause a histological response that causes them to develop dry skin called lichenification and eczematous lesions. Now, eczema is going to be more common in clients who have a family history of it. They think there's a specific protein gene that causes that. So they have two phases. They have the acute phase, which is those scaly patches, and then they have the chronic phase, which is plaques or lichenification. We also have something called incontinence-associated dermatitis. This is what you're going to see in people that are incontinent, like that use briefs or pads or diaper rash, is what we would commonly call it. That irritation is there around usually the peri area when it's exposed to stool or urine, and it causes a breakdown of that skin barrier. Seborrheic dermatitis, this is what we commonly call dandruff. It is scaly patches. It has that flaky skin. Now, it can occur in adults. You can see it also in infants, especially newborns. It's more prevalent in male clients. So what happens here is they get an excess of unsaturated fats on their skin. So it particularly is in that face, scalp, or chest area. Now, anytime we have a breakdown of the skin's protective barrier, we need to find out what has caused it so we know the right way to treat it. And of course, dermatitis is going to affect our clients anytime that we have a disruption in that skin barrier. We're putting ourselves at risk for some type of systemic infection. So think about the person that has maybe poison ivy. They develop poison ivy, that allergic contact dermatitis, but they can also get something like anaphylaxis because that allergen enters their bloodstream. And then once that anaphylaxis occurs, the body is going to systemically respond to it. So if we have someone who has poison ivy, they have itchy skin, if it starts where they're having difficulty breathing, the first thing we want to treat is that systemic response. We want to treat that breathing first. We can hold off a minute on that, treating the rash that accompanies it, but we want to make sure that we get that anaphylaxis taken care of, because that's what could kill them. Irritant contact dermatitis, for this one we want them to understand what's causing it. If it's maybe the type of diaper we're using on our baby, maybe they're allergic to that plastic. People that have had surgery and have their wounds covered with tape, sometimes they're allergic to that tape, or that tape can irritate their skin, especially in our older adults that already have that thin skin, and we maybe they have a wound and we put tape over it and it just gets really red and irritated at the site where we have the tape adhered to. Another thing that we worry about with dermatitis is it can cause them not to be able to sleep well. Just so think about that. If you're itching all night long, it might make it difficult for you to get sleep. The other thing is embarrassment. If we see somebody with severe areas of, say, eczema on their arms or on their face, that can be socially embarrassing to them as well. And so we want to make sure that we give them that emotional support that they need, that psychosocial support. So how are we going to treat dermatitis? Well, we have a couple of options. We have topical corticosteroids. So an example is going to be the triamcinolone cream that we use. We want to be real careful when we use these things. We just want a very thin layer. In this instance, less is more. A lot of times we think if we can just slather on a bunch of cream, that'll work faster, and it doesn't. We also have to remember that some of these corticosteroids, that can thin out their skin and it can cause skin breakdown. So we want to use the minimum amount possible. So if we see these prescribed, we know they're prescribed because they have that anti-inflammatory response, and they also have an immunosuppressive effects. We have creams, we have ointments that we can use. Ointments are always going to be more potent than the creams are. Ointments are going to have that occlusive property that's going to keep that medication there, and it's going to help with medication absorption. Now, even though it's topical, it can have both local and systemic effects. So using these topical corticosteroids, that can predispose them to skin infection. So we want to make sure that we, again, watch those areas. If they're showing any other signs of infections, we want to have them report those. Again, we want to use it sparingly because, as I said, it can cause some infection, just like a regular steroid, which has all the same side effects as an oral steroid. Immunomodulators, tacrolimus is one that we're talking about here. This also can weaken the immune system. It is an anti-inflammatory. This is used more when we have a moderate to severe dermatitis. If we're using corticosteroids, it's not working on them, we might bump up to this medication. Some side effects they might see with this is a burning sensation or itching. Usually they adjust to it. The more they use it, the less they're going to see those side effects for that. Again, teach them thin layer. Less is more in these. Rosacea is another issue that we see with the skin. This is a chronic inflammatory disease of the skin. It shows us as flushing, erythema, or redness, or telangiectasia. That is maybe papules, can cause papules, pustules on the nose, chin, forehead, and cheeks. The telangiectasia, which is very hard to say, that's what you see when you see those little dilated blood vessels, okay? You see those red or purple lines on their face or on their mucous membranes. That's what that is, okay? This is caused by dilation of the lymph and blood vessels in their face. So this can happen if they're exposed to extreme temperatures. Some people, if they eat something hot, spicy, it can cause that. Alcohol can also cause this as well. It causes the dilation of those blood vessels. It's going to cause flushing, redness, can evoke an inflammatory response. So lifestyle changes like avoiding alcohol, avoiding spicy foods. Some soaps can irritate this even more, so we have to figure out what's causing that. Now, if they're having papules or pustules, we can get some scars for that, so we want to treat that as best that we can. We also want to know that it can spread to the neck, chest, scalp, ears, back, and of course, when somebody sees someone with rosacea, it can cause a body image disturbance for that client. Can cause them anxiety or depression about going out into the public. Now, usually they don't have a lot of discomfort with this. However, in their nasolabial folds of the nose, it might start thickening up that skin, and that can be uncomfortable for them. So to treat it, we're going to give them antimicrobials, metronidazole, azelaic acid, that is a topical acne agent, which goes with the antifungal. And that's going to prevent bacterial protein synthesis. It's going to restore that normal keratin process. So rosacea, acne, this is something that we would use. Mild to moderate, just rosacea only with no acne is when we're going to use that metronidazole. Contraindications would be someone already with asthma or someone with a really dark complexion because it can change the pigmentation of their skin. Some of the side effects we might see are burning, stinging, scaling wherever we place the cream. We want to teach them why they're taking this medication. Report any systemic effects like hypersensitivity, if they start having difficulty breathing, if they start having swelling of their face or lips or tongue. We want them to wash that area thoroughly and dry it before they put any medication on, and we also want them to avoid using harsh soaps. The next medication we can use is an alpha adrenergic agonist. So brimonamide is another topical agent that we can use here as well, and it's going to stimulate the alpha-2 adrenergic receptors. It's going to reduce that erythema or that redness through vasoconstriction. So this is going to reduce that appearance of flushing, that facial redness. There is not a systemic effect when we're using this topical medication. We still want to use caution if they've had depression or cerebrovascular or cardiovascular disease when we're given these as well. Side effects are going to include redness again, flushing, burning, can cause some pallor, some pale skin, or they could be allergic to that medication and get some allergic contact dermatitis. If that happens, we want to tell them to stop, don't use that medication anymore. Go and wash that area where you applied it with soap and water to get rid of that. If they are on this medication and they also get prescribed an antihypertensive, central nervous system depressant, because this is an alpha adrenergic agonist, we want them to let us know so that we can change the medication for them.